Hi everyone, I'm Tamara B Rodriguez, live today from our Baptist Health Newsroom, and we're kicking off Breast Cancer Awareness Month. As a breast cancer survivor, I truly enjoy using my voice to spread awareness. And here's a fact that many people don't know. 1 in 8 women will develop breast cancer in her lifetime. However, the diagnosis of breast cancer today is not the disease of the past. And there are more than 3.8 million breast cancer survivors. Joining me today is Rosemary Carrera. She's also a survivor, a mother, and an advocate for battling beautifully. Welcome, Rosemary, and thank you so much for being here.
Thank you for having me.
Before we dive into today's topic, I'd like to remind everyone to send us your questions, and we'll try to answer the best that we can with the experience that we have. Rosemary, how are you today?
I'm doing well, thank you.
So everyone remembers that moment when they got the call, when they were diagnosed. So talk to us about your experience, your moment when you got that phone call.
So I got that call on Thursday, August 23rd of 2018. I was working, I was in the middle of seeing patients. And so when I spoke to the doctor and she told me it was positive, it was probably the most shocking thing I've ever experienced in my life. I work with my family, so I went right over to my mom's office next door and I was like, all right, it's positive. What are we going to do? Let's get everything together. We have to organize work. We have to organize childcare because at the time my daughter was 8 months old. Wow. And we just had to figure out how to get the wheels in motion to take care of it as quickly as possible, and to try to keep her on a routine as much as we could, because we didn't want to have her affected by it.
And did you get regular routine checkups?
So this was actually my very first screening for turning 40. I went to see a new primary care doctor for something completely unrelated. And so at the end of the exam, he said, okay, we're going to do these tests and then your mammogram as well. And I was like, mammogram? Why? Hey, you're 40, it's time. I said, all right. And I think he saw the reaction on my face and said, look, you can get all the tests done at Baptist, get it done at the same place at the same time, and just get it out of the way. I said, okay. So I went and had it done, and when I did the screening, the technician actually told me not to be surprised if I got a call back because I had very dense tissue. And she said that there were a lot of areas where it was very difficult to see what was going on, so they would most likely want more tests to have done. And indeed, they called me for a 3D mammogram and then for the sonogram. And where it came up was in the sonogram. My tumor was mammographically occult, so you couldn't see it on any mammogram. And then following up with an MRI, they actually found 2 more tumors on the MRI that hadn't been seen on either.
Wow. And what were your initial thoughts? Like, what was your reaction?
I was shocked, floored. I mean, I had just gone back to work a few months earlier from maternity leave, so this was not on my radar at all.
It wasn't part of the plan.
Not at all. This is not what we had in mind. This is not what we were expecting at this point, but this is our journey, and we took it all together, family, friends, and I had an incredible support group.
Yeah. So Rosemary, I've been following you on social media, and you exude so much positivity.
Thank you.
You know, and you give so much strength to so many people that don't know how to find that strength. Where do you come up with that? What gives you this positive outlook on such a tough situation?
You know, I think first of all, having a good support team makes a really, really big difference. So right from the moment of diagnosis, I knew I wasn't alone in any of this. Between my family, my friends, I had an incredible group of doctors at MCI working with me. Dr. Mottner, Dr. Medina, Dr. Wang, Dr. Rodriguez. They were all incredible from the beginning. And knowing that they were confident in what my outcome was going to be made me more confident, made me more positive about the whole situation. Again, going back to having a support group, it's really important to have family and friends there to help and lend a hand. Your friends are going to want to know how to help you, and I think as women especially, we always try to be as strong as we possibly can, so it's very hard for us to accept help from others.
Yes.
But this is a time where you take all the help that you can get, because it's really going to help you focus on getting better.
Yes, and I always say that the support, the family support, is just as important as the medicine. And I don't think people realize that, how critical that is.
It really is.
And treatment is individualized for each cancer patient, and every cancer is different, and everybody has a different reaction. And can you talk to us about your treatment plan? What did that look like?
Sure. So my treatment plan started with a double mastectomy. October 10th will be 1 year since I had my double mastectomy. And from there, everything else was more preventative than anything else. So after the double mastectomy, I went on to have eight rounds of chemo over the next 4 months, which that was interesting time. You know, with chemo, you have your bad week, and then you have your good weeks, and you try to take advantage of those good weeks as much as possible. And my chemo sessions ended up being parties at Baptist.
Awesome.
I was afraid sometimes that we would get kicked out.
That's awesome.
I had intended on using chemo time as, you know, time to read and catch up on certain things, maybe learn some Italian. Or that didn't happen. We ended up having visitors 12, 15 at a time sometimes.
Wow.
And it was wonderful because it was such a distraction, and there was a lot of love and support, which made it so much easier to go through. After those 8 rounds of chemo, I had a full hysterectomy for hormone suppression purposes, and then 28 rounds of radiation, which I finished on June 20th.
Wow, that's amazing. I too had a double mastectomy in November, I think 2016, and I wasn't supposed to have chemotherapy. So after they did additional tests and they realized that I would need chemotherapy, and I started losing my hair, but you know, I didn't want to look like a patient. I didn't want to look like a chemo patient. So I would wear wigs and I would do different things to try to feel better and to look better. And I know that you live by the phrase "battle beautifully," and I think it's phenomenal. Talk to us about, again, what helps you to feel beautiful and keep up that attitude of, you know what, I'm going to look at this straight in the eyes and I'm going to battle beautifully.
So we are all beautiful, and we have this beautiful strength within that we tap into when we really, really need it. And for me, it was understanding that days were going to be bad, and I had to give in to those days because it was what my body needed to heal. But the days that I was feeling well, I wanted to go out and conquer the world. But it was really, really hard to feel like I could conquer the world when I felt one way inside, and I'd look in the mirror and see something totally different. I felt strong and powerful on those great days, and when I'd look in the mirror, I'd see green skin, my eyes were sunken in. I looked like a cancer patient, and I didn't feel like a cancer patient on those days. So I would always tell my husband that I would put my face on, you know, heavy moisturizer, concealer, bright lipstick, big earrings, whatever it took to look the way I felt inside. And that way, when I would go out, instead of getting that "oh, poor girl" look from people, which it's really hard to get that look, I would get smiles and hugs, and people would just say, "You look beautiful today." I'm like, "Thank you." And I think you need to kind of embrace those days as much as possible, and do what makes you feel beautiful, whether it's wearing a wig or wearing a scarf or big hoop earrings, whatever it takes. But you have to find a way to tap into that inner beauty, that positive energy, and just really get it out there, because the more positivity, the more beauty you put out in the world, you're going to get back.
I totally agree with you, and that was part of my mission as well, that I wanted people to realize that, you know, the support was critical, and I also wanted to destigmatize cancer. So I didn't want to look like a cancer patient. I wanted to educate people about cancer. I wanted to educate children about cancer, because I truly believe the earlier children know about the illness, the better it's going to be when they get older, and they're going to be also more empathetic to other patients, you know? So I'm reminding everybody, if you have any questions, please send in your questions. Rosemary will answer questions that you might have, and we'll be happy to tell you more about our experiences. I know that it's very symbolic for cancer patients at the end of their journey, their treatment journey, to ring a bell, right? Symbolizing the end of that moment, of that long moment of treatment, whether it was 6 months, a year, 2 years. And so today I brought this gong, and I thought it would be very symbolic if both of us and rang it together. We're both done with our treatment, I'm celebrating 5 years this year, this October actually. So I thought it'd be nice if we did it together. What do you think?
That sounds great to me. I think it's important to mark the end of a long journey. And you have to remember that although your journey may be different with cancer, it doesn't make it any less significant. So everyone deserves to ring their bell.
That's correct. Awesome. Ready?
Yeah.
Awesome. We did it. Okay, so reminding everybody, send us our questions. I wanted to share with you that I wrote a children's book, 2 children's books actually, that really helps parents and educators, the health profession, to introduce cancer to children. That way, again, we take away the stigma about cancer, and we help children really take control of their lives and eat healthy and live healthy lives. And also remember the support, how important the support is for the person, the family member that could be sick. Sometimes people forget too that the kids can be the patient, right? Absolutely. And so the second book, Teo the Great, that I wrote is about a boy that goes through leukemia. This is an everyday fact for so many people. It is. You know? So that was my way of giving back to a community that was so good to me, and that was my way of sharing a little something to help other families.
I think it's great because we have to teach our kids at an early age that they have to be empathetic, and it's important to, when you see kids going through cancer, treat them just as you would any other kid. And I think that's what they thrive for. They want to just feel like everything is normal with their days. So that's important. Yeah.
I forgot to mention too that we have an awesome video of you, ringing the bell at Miami Cancer Institute. Talk to us about that day. What was going on? What's that? You have a tribe, huh? Look at that.
I do. That was my last bell. That was
my
radiation
look at that.
bell.
Look at that.
And there's actually a lot of people even missing from that picture because they couldn't be there that day. But I had an incredible group there with me. And
that's a tribe.
It is my tribe. And I actually Facebook Lived it as well because people who didn't live in Miami wanted to be part of it as well.
Wow.
And it was the best feeling. I had my chemo bell a few months before then, and it was really different ringing that bell compared to ringing the last bell. When you know that's it, I'm done with this. I'm ready to just start over.
That's really great. And you know, I have to tell you that I feel very inspired by you today for many reasons, but especially for having Facebook, put that live on social media, Facebook, Instagram, because I don't think that I had that courage at the time to do that. And I think it should be noted that it takes a lot of strength to do that, you know?
You know, at the beginning, I didn't want to tell anyone about it. I didn't feel that anyone needed to know what we were going to be dealing with, what we were going to be going through. And I really didn't post much on social media before this. But because I was diagnosed after my very first mammogram, I had no symptoms whatsoever. I felt no lump, nothing at all. I felt that it was important to get the word out for women to start getting their mammograms at 40.
Right.
So it's important for you to do your monthly self-exam, but you need to start doing those mammograms at 40 because that's when we find that early detection is key. Early detection is what saves lives. So get that mammogram at 40. If your doctor says you don't need it, find another doctor.
I say that all the time. I say if the doctor says you don't need it, you find another doctor. But I would also say to know your body, because I was actually diagnosed before 40. And part of my advocacy is to remind people to know your body, know your breast, speak up. because sometimes doctors or just, family members would say, hey, it's just, it's nothing. Don't worry about it. It's going to go away. You're not 40 yet. Insurance is not going to cover it. And to that I say, again, change doctors or find somebody that will listen.
Exactly.
Because had I not listened to my body and reacted, I probably wouldn't have made it to 40.
Right. Exactly.
Okay.
Right.
So oftentimes I wonder, should I talk about it? Should I promote the things that I promote? But I think it's incredibly important because other people will hear your story and hear my story and hopefully act and hopefully get the mammogram. Go to Miami Cancer Institute, get the mammogram, get checked. It saves lives. Early detection saves lives. We know this. So, I'm hoping that today and every day forward, we serve as examples that early detection saves lives.
Exactly.
Do we have any questions? We have, what would be, this is for you.
Okay.
What would be the first thing you can do when a friend or family is diagnosed?
I would say that the first thing would be tell them that you're not alone. They're not alone. You're there for them in any way that they need. And listen, because sometimes we just need to vent about how we're feeling or how we're doing, what's going through our heads, and it's really nice to have someone who can just stop and listen to your concerns. But primarily, I would say let them know that they are not alone.
I agree with that. I would hug them and I would say it's okay to cry. It's okay to be sad. It's okay to, like you said, to vent and be angry. But to remind them that they're not alone, absolutely. Also, I would say to get second opinions and third opinions too, so you could feel confident about the treatment plan.
Yeah, I agree. I felt very confident with my first plan, with my first doctor, so I didn't feel a need to have to get another opinion, but it's because I felt comfortable with my doctor. If you don't feel comfortable with your doctor and with what the decisions that are being made are, then absolutely get another opinion.
Right. So we have another question, and that is, what advice would you give for family members to do and not do? That's a good one.
Ooh, that's tough.
That's a good one.
I would say for family members to, again, ask, how can we help? What do you need us to do? It's very overwhelming at the beginning because the decisions that you're making are so quick, and everybody has an opinion. I had a lot of questions as to why I was getting a double mastectomy. Why don't you just have a lumpectomy? It's like, you need to trust that the person is making the decision that's right for them. So don't give your opinion. Be careful with the opinions that you give and the stories that you have about other cancer patients, because everybody's story is completely different. Everybody's situation is different.
Yes, that's very important.
But you have to trust that the decision that they're making is the right one for them.
Yes. I would also say to family members to not be in denial and not, not try to contradict what the specialists are saying. Definitely. Because you have a lot of, the older generation that will say, well, do this, don't do that. It's because you didn't eat this, now do that. Rub this, don't rub that. I think it's important for family members to trust the specialists, to trust the doctors, and know that there's a process.
Right. And we have to remember that breast cancer treatment in particular, has changed so much over a short amount of time.
Yes.
It's very different from what it was 20 years ago versus 10 years ago versus even 5 years ago.
Yes.
So things are constantly changing, and the treatment protocol is always different. So because you knew someone who was diagnosed with breast cancer 15 years ago and they did X, Y, and Z, it's possible that is not done anymore. So you have to keep in mind that things are very different now than what they were before because of the advances.
Right, and everybody has a different story.
Yeah.
So your story is not my story. Your cancer might not have been my cancer.
Right.
So it's not good to compare. I think that's also really important. Another question, what's the best way friends can help while getting treatment?
So in my situation, my friends helped with a lot of meal prep.
Yes,
so I
that's
had
awesome.
lots of meals brought over. They came to visit during chemo. They came, just sending texts, calling to see how I was doing. It's nice to be reminded that you have that support. So just pop in from time to time, send a text, send a call. it's not always appropriate to drop in at home because you may be having a really bad day and the last thing you want to do is sit and chat for 15 minutes.
Yes.
But just remind them that you're there for them.
Yes, I think that's great advice. I love that. And it seems like you were very blessed with a wonderful support system.
I am extremely blessed.
Yes.
Extremely.
And I thank you so much for being here today,
Thank you for
Rosemary.
having me.
Thank you very much. As we close out this segment, remember to follow us on social media. Our handles are right here on the screen for you. Follow us on Facebook, Instagram, Twitter, LinkedIn, wherever you can find health news and events here at Baptist Health, South Florida. And I am Tamara B. Rodriguez, and I will see you next time.